So we know anterior, superior, posterior. Now we got our this part, this part. Now come on, don't tell it this is inferior surface. Nah. This is not inferior surface. Think about like this. I told you, try to visualize these things. What is below the liver? What is below the liver? Organs. Your intestines, your liver, your stomachs, everything there. So what we know those things, those are visceral organs. Visceral organs, visceral organs. So all these collectively are known as visceral organs. Just remember this. So what we will call them? Visceral surface. Visceral surface. Why? Because it is in the direction of visceral organs. Claro. So we covered 4 surfaces. What is the last surface? We forgot about the base. The base. So now try to is just to visualize you guys, okay? So this base, again, I already told you, try to visualize base is in the right side. Do we have something here? Yes, we have what? The ribs. Yeah, ribs side. Come on, try to feel it. We don't have anything except ribs, little bit of lungs, and in between the ribs and lung is something what? Pleural cavity, parietal and visceral, you got us right? Those things. So you will try to feel it and you will just get your answer. Try to feel it. Put your hand and take it in word. Try to feel it. Feel your body, you will know your answer. So we have 5 surface. Like I am repeating those things multiple times because I want you guys to emphasize it. So you will retain it longer. Take it easy and listen. The more you listen, the more you will get. So like what is it? The resonance, in amygdala. There is a Pappus circuit. The more you listen, the more you think, there will be the more circuit, and what will happen there? There your long-term memory will convert it into short-term memory. So that's why I am repeating. Repeating is a very good thing. So you got the base. So five surfaces covered. Okay. Now 5 surfaces covered. One border. What is the border? Okay. If you try to visualize it, border, you should look the gross actual level. Just Google it, the actual gross level, and you will find it. What is the inferior border? Now, what is this? Our anterior surface, and this is the visceral surface. And here is our inferior border. So now try to visualize it like this. This is your anterior surface. Okay, so anterior surface of the liver, and this is your visceral surface of the liver, because this is going in the direction of visceral organ. Now put your finger like this. And the surface you are seeing right now, which is anterior side, which is in the direction of abdominal wall, this is our inferior border. Try to visualize it. Okay, try to visualize it. So this is our inferior border. So inferior border is inferior, but it is in the direction of anterior side. Not in the posterior side, not in the right side, and neither it is in the left side. It is in the front side, anterior side. Okay, so this is we are done with our 5 surface, 1 borders, and lobes. Now lobes. If you want to see lobes, there is a way to see lobes according to the surface. We have 5 surfaces, but let's draw a diagram first. Mhm. So this is a diagram which is from the anterior. So this is basically anterior and superior surface. So basically, what you are seeing my this surface, okay, this surface of my liver. When you see this part of the liver, you will get two lobes. How? So we know here is our calciform ligament. Okay. Now you'll say, sir, now what is this ligament? How this comes? How this forms? We'll go there. But for now, believe me, here is one ligament which is known as calciform ligament. Now this calciform ligament divides this entire superior surface into two lobes. Okay, so we know there is the one I was talking about, the left and the right. You know, the right is bigger and the left is short. In this diagram, you can see one small, one big. So big is always right and small is left. So in anterior superior surface, you can see two lobes, left lobe of the liver and the right lobe of the liver. But when you see the posterior surface, now you are looking my liver from my back, So what you will find there? So first, let's draw a diagram. Okay, you know, let's one at a time. Let's not jump to different things. Here is one structure, okay? So I was going to tell about, so I will tell about this structure, and here will be one another structure. Okay? We'll go at that. We'll go. Here is another structure, okay? We'll go there. But for now, what we will see here. Now think about, there is one line like this. Another thing is like this. Bear with me. One thing is like this, and another thing is like this. Bear with me, okay? Bear with me. Posterior is a little bit complicated, but you know, practice makes perfect. So the first thing I will tell you to do, draw. Draw. The more you draw, the more you visualize, the more you get it. Now, we have here two ligaments. Like, now think about this. This is one plane, okay? Try to visualize. This is one plane. Now here is our two ligaments. One is ligamentum teres. From this inferior border. I hope now you already get what is the inferior border, okay? So this is inferior border, okay? From this inferior border, ligamentum teres, and from here we got ligamentum venosum. Actually, these two things are a same line, but nomenclature is different according to their locations. Okay? Think it as a same line, but naming is different due to their different locations. So here we got a line which is composed of two ligaments. One is ligamentum teres and ligamentum venosum. So if we rip this ligament, there will be a shallow region like this, a groove, a tunnel, So this is one structure you can see. What is the second structure you can see? Here we go. Our porta hepatis. Basically, we can see three major things One is this, but the direction is different. The direction is different. In this direction. So bile is producing in the liver, and from the cystic ducts, it's coming to the this location. But yeah, this is also going to the upward because there is two branches. Like one is going. So like two branches means boom. Okay. Like this. Some stores here. Some goes directly to our duodenum. Not directly. I shouldn't say directly. This is our pancreas. It first merge here and pull out water, then it's going to duodenum. Let's focus here. So we got our first structure here. These two ligaments. Second structure is our porta hepatis. Third structure is our gallbladder, and fourth structure is our inferior vena cava. Now you will say, sir, this is all memorizing fact. Yes, this is all memorizing fact. That's why I told you previously, draw it. There is nothing you can do about it. If you have hands here, you call it hand is hand. Now you are not going to tell this is leg. So bear with me, memorize some facts, then go to a conceptual approach. First memorize, then go to a conceptual approach. So I told you we got 4 areas in the posterior part. So this is the small part left. This is the bigger part right. Bear with me, I will tell you. This is our quadrate, and this is a quadrate 4. So caudate and quadrate. Cauda means tail. Now, what is the borders? You can just see here and tell. So what you can see here, a ligament. Now, when you say this ligamentum venosum, if we rip the ligamentum, and you will get a fissure, a depression, just say left side of the ligamentum venosum fissure. It's that simple. When you are saying caudate, not coward, it's caudate. So when saying the right side inferior vena cava, left side the fissure, inferior side the hepatic cord. Same goes from a quadrate, right side, boom, you know it, right? Gallbladder, superiorly, the left side, and the right side, you can just tell this border. This is actually a line, this actually comes in a line. I will tell you in later lecture what you can do with this. Basically, we know segments. How many segments? 8 segments. So when you talk about these 8 segments, we will virtually mix these lines and divide this liver into 8 segments according to their supplies of arteries and venous drainage. So in anterior you got 2, in posterior you got 3. I'm not writing these whole things because I am giving you an overview how to read it. Okay, after listening my lecture, go to the textbook, whatever textbook you read. Then when you start to read, you will feel easy because you already know the organization, all these locations, how they are dividing these things. It will be easy for you. Okay. So we are done with our lobes. Okay. Now, relation. In relation, we will talk about 2 types of relation. One is a peritoneal relation and a visceral relation. Okay, so peritoneum is a chapter, is a different, a vast topic. I will make a video about that. You will watch it later, but bear with me. I will tell you sufficient that you can understand this with respect to liver. Now, what is peritoneum? What is peritoneum? It's to make it easy. Sandwiches. What happened in sandwich? You have one bread, another bread, and in between two breads, whatever you like, if you are veg, non-veg, whatever it is. So now think it like this. We'll make a sandwich. We'll make a sandwich. Think this a balloon. Balloon. Okay, this is also a balloon. And here we got our visceral organ, whatever it is, liver, stomach, intestine, okay, whatever it is. Now these two compress or comes together and covers the visceral organ. This is the simplified version of peritoneum. Okay, so when this covers this organ, so for simplicity sake, so it will, like, there will be one part like this which will be sticking to the visceral organ. Okay, another part will be like, think about this abdominal wall. Okay, think about this abdominal wall. So okay, when I tell about two balloons, so where is the two balloons located? Okay, you can't visualize, let me help you. Again, abdominal wall, our six packs, in the back our vertebra. So in this abdominal wall, think about, here is a one balloon, and the posterior and the superior part, in the superior part of this abdominal cavity, there is another balloon, and these two balloons compressing the liver. Now I will only talk about liver. Okay, so compressing the liver. So here we got our, like we say, visceral peritoneum. Visceral, like visceral peritoneum. What is the viscera? Viscera means organ, and which is attached to the viscera, to the organ, is known as visceral peritoneum. And parietal peritoneum, parietal means far. So this is parietal peritoneum. Same goes from here side. Here will attach to the visceral and parietal peritoneum. There is a basic small thing. Now comes to the real our main topic, liver. Now how this goes, let's take another diagram. Okay, and this diagram we will take this section. What is it? Transverse section? No? Longitudinal section? No. Okay, you got it, right? Sagittal section. Got it. So now take a sagittal section, and sagittal section we always get an anterior and posterior view. Now think about, this is our anterior abdominal wall. This is our vertebral column for simplicity's sake, and this is our liver, and this is our, you guessed it right, diaphragm. I already tell there is two balloons. Now think about, one balloon is wrapping, covering. Think about, is a balloon. This is a full balloon. Now I'm not going into the answer. Okay, there is many different things. Like this is a balloon. The liver pushes in the anterior, and here we got one peritoneum. And I all told you there is another balloon, second balloon. Now think about like this. There is coming the second balloon, viscera. Okay, and the second balloon comes from posterior, from the vertebral side, and boom. Okay, so we got here visceral peritoneum and here parietal peritoneum. But you will see, sir, you didn't fuse those two balloons. Yeah, I didn't say I didn't fuse, God didn't fuse. That's why we are learning like this. Okay, I don't know, God had some creative things. Okay, so the thing is here, God didn't fuse, so we'll say, okay, here we got our bare area. What? Bare area. What do you mean by bare? Like bare means actually, like, think about like when you say bare hand, I will punch you with the bare hand, which means a naked hand. But it's like, no, I will put a gloves, then I will punch you. So now hand is not bare. So when I'm talking about a bare liver, that means there is a no peritoneum. Okay, clear with this. Okay. Now you see this shape. So here, this shape. So these two peritoneum now are going to form two ligaments, coronary ligaments and triangular ligaments. Now these two things will form these two ligaments, and these two ligaments will found in which surface? Diaphragm surface. So which surface? Superior surface. Got it? Yeah. Now you got it. So now when I'm talking about your ligament, like come on, ligament is also hair. So it is made of peritoneum, no connective tissues. So even though there is some nomenclature, like don't confuse with this nomenclature. Okay, so this is our ligaments. And now when I say coronary ligament, it's a coronary artery. Nah, it's here, heart. This is different. Okay, so coronary ligament. So what I was tell you here, the origin of the ligament. The origin of the ligament is what? The origin of the ligament is peritoneum. Okay, if you have any questions regarding this peritoneum, or if you want a full lecture in this peritoneum with more details, you know what to do. Comment down it. Now, there is another thing we have to remember. When I say this is liver, now this is esophagus, and this is our stomach, this is abdominal esophagus. Huh? Now when I told about balloons, this is anterior surface, okay? One balloons, another balloons from, you know, there is a gap here, which is normally a gap present. So think about this, try to visualize it. So balloon from posterior and anterior, balloon cannot fuse here because here is liver, cannot fuse here because here is stomach, but can fuse here because there is nothing.